Hello, everybody. This is Gary. Today is Saturday, February 25th, 2023. It's 2:56 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my anxiety levels are very high. It's cold outside. The pain in my right knee from the surgery is much worse during the winter. My anxiety levels are kind of shooting through the roof right now. My paranoia is very strong today. I thought somebody was following me today when they weren't. So my delusions are part of that. My auditory hallucinations are not that bad. My depression is kind of severe, but I'm coping. I'm sticking to my work and my daily schedule. Um, I saw my peer support specialist earlier this week on Thursday. We had about a 45-minute meeting we do every 2 weeks. She is a counselor with a mental health diagnosis who works on staff at my clinic as a counselor. But I also have a more formal psychotherapist, and of course, I also have a psychiatrist and a primary care provider. Um, I try to keep all of my appointments to keep myself physically and mentally stable. I rarely miss appointments. I have an appointment on Monday with my gastroenterologist. I have a lot of things to complain about. When I eat food, it tends to get stuck in my esophagus. It doesn't block my airways, but it does not go down all the way. And I actually went to the emergency room a few weeks ago because of that. I have a hernia in my esophagus. I have constriction in my esophagus, and I have acid reflux, which has caused esophagitis, making it more difficult to swallow. So I will be complaining to my gastroenterologist about that. And the reason I mention that is because a lot of the difficulty in swallowing comes from the Seroquel that I take. I take quite a bit of Seroquel. It's about 600 milligrams nightly. It used to be as high as 1,000, um, but 600 milligrams is still pretty high for Seroquel. Seroquel is an antipsychotic and mood stabilizer. Um, I know people who do 25 milligrams of Seroquel and they just basically pass out. I'm on quite a bit of Seroquel. I take it all at bedtime to help me sleep. Um, but it also acts as a mood stabilizer and an antipsychotic. The only other antipsychotic I'm on is Zyprexa, and that's 5 milligrams twice a day. That's supposed to help me with my paranoia and my auditory hallucinations when they flare up and get worse. Um, I am seeing my psychotherapist this upcoming week, and the day after that, I'll be seeing my psychiatrist, I believe, on the 2nd and 3rd of March. I'm not sure about that. I would have to check my calendar. I don't suspect that me and my psychiatrist are planning to change any of my medications. There's nothing going on that would warrant that. Um, so it's more of a just a check in and going over things with my psychiatrist. And of course, my psychotherapist is someone I see every 2 weeks because winter is more difficult for me. This time of year is more difficult for me. And so I see my peer support specialist every 2 weeks, my psychotherapist every 2 weeks, alternating each week. And then I see my psychiatrist once every 4 weeks. Um, my psychiatrist is a resident, which means I have to change psychiatrist every year or so because the psychiatrists, they give me a psychiatrist who are still in their medical training. They have MDs and they are psychiatrists, but they are still in the process of working on their career. And so I will be assigned a new psychiatrist, I believe, in June or July, unless for some reason that plan changes. But yeah, I go to a publicly funded clinic that's part of the University of Rochester, which is a teaching hospital. So a lot of the psychiatrists I have at my clinic are they're doctors. They have a medical degree, and they are psychiatrists, but they're still going through the residency part of their training, and that means they eventually move on to a new phase of their training, and I end up getting a new psychiatrist every year. I've been going to this clinic for quite some time. Every once in a while, the psychotherapist will change. Um, I just recently changed or not psychiatrist, psychotherapist a few months ago because the psychotherapist I had decided to move on to working with inpatient um, drug dependent people, people who are trying to get off drugs. And so I was assigned a new psychotherapist a few months ago, and that's worked out fine. I have no problem with my new therapist. But in a publicly funded clinic, things can change very rapidly with very little notice. And that includes getting a new psychotherapist, getting a new psychiatrist. The only thing that's been consistent over the past few years is that I have the same primary care provider I've had for quite some time. That doesn't seem to change that often. Um, I suspect it might in the near future, but it hasn't happened for a while. So, and I primarily see a nurse practitioner for my primary care as opposed to seeing the actual medical doctor. The nurse practitioner has a more flexible schedule for that. So I will be seeing, or not seeing, I'll be talking to my gastroenterologist over the phone on a Monday, this upcoming Monday. And I also have an appointment with a pulmonary specialist because I have pulmonary fibrosis. Um, and I will find out more about that when I see the specialist on March 28th. Right now, I only know that I get shortness of breath. I have scar tissue in my lungs that's causing that, and the scar tissue may or may not spread, and we don't know the cause. So that's all the report for now. Like, comment, share, subscribe.